How does the current Medicaid funding policy affect the financial stability and service capacity in rural hospitals? And then ultimately, how does that begin to affect access in rural areas?
So first of all, I want to thank Carasoft for hosting us, and to you, Jackie and eVisit, for having Rob and I here today. We're really excited to participate in this discussion. I think that was a really great introduction. There's a lot of change going on in our healthcare system right now, and I think we're all feeling it, as evidenced by the people participating. When you look at rural healthcare, about 20% of rural adults and about 40% of children that are in the rural area rely on Medicaid or CHIP funding. And so that really impacts the rural hospitals and the things that we know. And about 21%, I've got notes over here, 21% are expected to have a decline in Medicaid reimbursement in the hospitals. And the reason that that matters is because we're going to see impacts across all of the rural areas, and that will impact a lot of the healthcare delivery system and the delivery models. So Variety Care, we're a federally qualified health center. We actually are not a hospital-based system, but we provide preventative health care, and we are seeing already the impacts of hospital systems that are limiting their resources and or closing their doors. And so I think it's really important that we start looking at ways that we can reach patients across the state. We're in Oklahoma, so a state like ours that is really heavily rural. One of the ways that we're doing that in the state of Oklahoma is we applied for and received, you can do next slide. I'm going to have to get used to saying that. The state applied for this Transforming Maternal Health Model grant. And this was through CMS. And there were 15 state Medicaid agencies applied, and it's a 10-year payment model to look at how care is delivered. So I'm an OBGYN by training. I'm on the executive team at Variety Care. But one of the things that we recognize in Oklahoma is that prenatal care delivery and services to women who are living in a state with over 50% of the state has maternity health care deserts. We have to get creative in how our healthcare is delivered. And so we're now in the process of looking at outcomes and how we deliver care. And so over the next 10 years, we've just completed year one. The first 3 years are kind of setting up, looking at how this is delivered, but we're looking at how care delivery is provided. And a lot of that does start looking at remote patient monitoring, digital healthcare services, and how do we partner with our hospitals and our OBGYNs, who are really a small portion of prenatal care, and how do we get that care into these areas? Because it's not feasible to have an OBGYN in all 77 counties in Oklahoma. We don't have delivering hospitals in all of them. And so this Transforming Maternal Health Model is really an innovative way of thinking. And I think CMS is really starting to think about, how do we start stretching our dollar? How do we start looking at this? And virtual care and digital health is going to have to be a critical way that we are able to get healthcare to people further. So next slide will kind of tell you what the pillars are. So the access to care, infrastructure, and workforce. So how are we doing that? We have to really look at midwives and birth centers, doulas, data infrastructure. Again, I think this is really kind of that creative way. And these alternative payment models, you'll start hearing more and more. This is really value-based care. It's a big word right now, but it's really how care is delivered. But you can't just throw care at people without looking at quality and safety. And so that's another part of this pillar. And then the last is kind of what I was just talking about. How do we do whole person care delivery? And so we're looking at risk assessments, follow-up, postpartum care, and then really this home monitoring, diabetes, hypertension, signs of preeclampsia. When do we tell these people that live an hour and a half from the closest birthing hospital, it's time for you to get closer to a hospital. It's time for you to move in. So I think that's one way that we're really starting to look at innovative ways to use digital care and digital access in a state like Oklahoma to really expand our providers and our care.